Hi everyone, how are you all? Today we are going to see about ego defense mechanisms and their again subdivided into three methods. First of all, increasing trials, adopting compromise, withdrawal and the submissiveness. First of all, we will see about the direct methods. There are mainly subdivided into three methods: increasing trials, adopting compromise, withdrawal and the submissiveness. Increasing trials in the sense, here when one comes across the obstacles or finds it difficult to solve a problem, then he can prove his effort and behavioral process and attempt with a new decisions to cope with the environment. Then adopting compromise in the sense, here they can maintain the harmony between the himself and the environment. They may altogether change the direction. For example, if the person is having the interest to become an IAS officer, if any problem occurs and he may not become an IAS officer, then he can become an officer in a nationalized bank. That is the adopting compromise. Withdrawal and the submissiveness. In this case, here one may learn to cope with the one's environment by defeating the situation, accept and surrender them to that situation. Thus, it is the withdrawal and the submissiveness. Here, they can withdraw from that situation. These are all the direct methods. Next, indirect methods. Indirect methods in the sense, here they can seek the temporary adjustment. They can protect the himself against the danger. So, the people can use the defense mechanisms here so they can protect themselves. These are all the defense mechanisms in which the people use in their daily lives. First of all, repression. Repression in the sense, it is the unconscious and involuntary forgetting of painful ideas, events and the conflicts. That is the repression. For example, here, in case of repression, we can forget a loved one's birthday after a small fight. Second one, regression. Here, we will revert to a older, less mature way of handling the stress and the feelings. In case of regression, for example, if we take into consideration an adult, he may throw the temper tantrum when he does not get his own way. That is the regression. Next one is the rationalization. Here what happens? There is a justification of failures and offering the socially approved reasons for the socially unaccepted behavior. That is the rationalization. Here, for example, if the student complains of unfavorable hostile atmosphere for the failure in the examination, that is the rationalization. Next one, compensation. Compensation in the sense, here there will be the conscious covering up of weakness by overemphasizing or making up of a desirable trait. Whatever will have the desire, if it's not fulfilled, we will cover up with the other things. For example, if the student had failed in the exam, then what he says in his home, I am not interested in that studies, I want to go to some sports and to achieve something, I will try. So in that the child tries to convince the family members. That is the compensation. Next, identification. Identification in the sense, here they can identify the situation and they will try to escape from that. Next, displacement. Displacement in the sense, there will be the unconscious discharging of pent up feelings to a less threatening object. For example, in the office, if the person is having the bad day, so after coming home, he used to scold the wife. He displaces the feelings in the home. Next, withdrawal. If any sudden problem rises, they will try to withdraw from that situation, and if suddenly any problem comes, they try to withdraw from that situation. Sympathy. Sympathy in the sense, if suddenly any bad happens to any people, they will try to show the sympathy and they will try to escape from that situation. That is the sympathy. Next, projection. Projection in the sense, here the unconscious or conscious blaming of someone else for one's difficulty. Here, if we take into consideration two nurses, one nurse may blame the other nurse if suddenly any mistake happens, means she tries to throw the problem to the another one. That is the projection. Next, sublimation. Sublimation in the sense, here the conscious or the unconscious channeling of instinctual drives into acceptable activities. Here the aggressiveness will be transformed to competitiveness in business or the sports. That is the sublimation. These are all the defense mechanisms in which we use in our daily life, so we can compensate from that situation and we can solve the problem easily. Last one, what is the role of nurse in reducing the frustration and the conflict? If we don't use the defense mechanism, there will be the rise of frustration and the conflict. Frustration means the blocking of behavior directed towards the goal. Here we will block the behavior. Coming to the conflict. Conflict in the sense, it is a painful emotional state which results from the tension between the opposed and the contradictory wishes. That is the conflict. What is the role of nurse for reducing the frustration and the conflict? First of all, we need to encourage the patient. Encourage the patient in the sense, we need to explain them to accept the reality, to prioritize the goals and to change the behavior. Teach the patient. Health education is very important in case of clinical area. So, we can train them and educate them easily, so they can understand about their health issue. Next, help the patient. Help the patient in the sense, we need to set to achieve the goals and resolving the conflict situation. Help in the problem solving. Whatever they are having the problems regarding the disease condition, we need to help them in the problem solving. Avoid arguing. Never argue with the patients who suffer with the illness, because they may get irritated and develops the psychiatric disorders. Next, focus on the patient's behavior. Here, rather than patient's personality, we need to focus on the patient's behavior. Next, involve the patient, family and healthcare team members. Whatever the processes we are going to perform on the patient, we need to explain the patient, family and the other colleagues and the healthcare team members, so they can support us. Patient-centered strategies. Ask the open-ended questions. By asking these open-ended questions, we can collect the more information. Active listening. If the patient tries to say something regarding his condition or any other thing, we need to listen actively, so we can provide the better care to them. Use calm, respectful and attentive attitude. We need to develop the positive attitude towards the patient, so that they can trust us easily and they can share the information about their health issue. Anticipate the situations. Here, whatever that result in the conflict, we need to provide the care plan to prevent the occurrence. Respectful work environment. We need to promote the respectful work environment, so that they can modify their behavior. Then recognize the personal stress, because it may affect both the professional relationship and the personal relationship. So, we need to take the adequate steps to manage the stress. These are all the role of nurse in reducing the frustration and the conflict. In our next video, we will see about the personal and the social adjustment. Thank you one and all.